According to the Department of Older Persons, there were about 12.6 million elderly people in Thailand last year, accounting for 19.2% of the total population of about 66 million, and it is estimated that the number will increase by 1 million each year. Many political parties have unveiled policies designed for people who are over 60 years old, hoping to win their votes in the May 14th general election. Most of their policies are focused on improving healthcare services and increasing the allowances for the elderly, which is currently about 600 to 800 baht per month, depending on their age. We begin with the Palang Pracharat Party, which announced that they will increase the allowance for the elderly, 3,000 baht per month for people aged 60 to 70, 4,000 baht per month for people aged 70 to 80, and 5,000 baht per month for those who are over 80 years old. The United Thai Nation Party proposed 1,000 baht per month for all elderly people. It also proposed the building of more care centers for the elderly, recreation centers in communities, as well as tax cuts for companies which hire elderly people. Phom Chai Thai Party's policies include free life insurance coverage for all people who are over 60 years old. This includes the right to borrow 20,000 baht from the state to start a career and 100,000 baht death benefit. Meanwhile, Pheu Thai Party's policy is the continuation of its 30 baht universal healthcare scheme introduced by its predecessor of Thai Rak Thai Party. The program will be improved to cover all diseases, so elderly people can get medical services at the nearest hospital without having to wait in a long queue. Only an ID card is needed and the services will be free of charge. The Move for a Party's policy is to increase allowances for elderly people to 3,000 baht per month by 2027. The welfare allowance for low-income earners will also be increased immediately. At the same time, bedridden patients will receive an allowance of 9,000 baht per month to be paid from the Fund for Elderly People. The Thai Sang Thai Party proposed a pension policy in which 3,000 baht per month will be given to all elderly people, with the first batch of 5 million who do not have enough income to receive the allowance in the first phase. A free healthcare program will also be provided for all elderly people. There will also be voluntary and mandatory savings programs to encourage people to start saving while they are young. The Democrat Party proposed the extension of the retirement age beyond 60, a readjustment of the health insurance systems to have the same standards in providing care for the elderly, and imposing a compulsory retirement savings policy. The Chhat Pathana Kla Party proposed the creation of 500,000 new jobs for the elderly population, as well as providing 50,000 baht each to renovate houses for the elderly and the handicapped. Last but not least, the Chhat Thai Pathana Party also proposed more jobs for the elderly population so that they can earn income, as well as giving an allowance of 3,000 baht per month for the handicapped.